What's the most important thing to understand about brow lift surgery? Well, certainly one of the most important things to understand is the fact that all brow lift surgical techniques, except one, raise the frontal hairline, and a higher frontal hairline makes a patient look older, not younger. An older technique is known as coronal brow lift, and this involves an incision placed across the top of the head, essentially from ear to ear, behind the frontal hairline. And by the way, that is a technique that I've never performed on a patient. A coronal brow lift elevates the brows, but in doing so, it pulls the frontal hairline higher. Likewise, an endoscopic brow lift, which uses much smaller surgical incisions, but again, placed behind the frontal hairline, can elevate the brows, but in doing so, it also elevates the frontal hairline. The one surgical technique that is effective at brow elevation that does not elevate the frontal hairline is called a hairline incision or pretracheal brow lift, and this involves a surgical incision that runs along the frontal hairline. Now, as you might imagine, patients considering this surgery will generally express some concern about the prospect of having a scar in that location. But there are surgical techniques that can result in a at least inconspicuous, and in many cases, a completely invisible surgical scar. Those techniques include using an undulating or irregular pattern for the incision as opposed to a straight line incision and scar, and beveling the incisions to preserve hair follicles so that hair shafts actually grow across the scar, helping to conceal it. If you already have an elevated or high frontal hairline and are considering a brow lift surgery, make sure that your surgeon can discuss with you their approach to the hairline incision or pretracheal brow lift.